Hi Justin, is it true that many healthcare providers shift the cost of Medicaid and Medicare patients onto their commercial insurers?
That's right, Jan. When the National Business Group on Health looked at 65 cities, it found cost shifting in many locations.
What is cost shifting? It sounds like what happens to me when I take my deadbeat brother to lunch.
Not quite. Cost shifting has to do with Medicaid and Medicare reimbursement rates. They vary according to the type and place of service. But generally they pay less than commercial insurance.
How do Medicare and Medicaid pay less? What do I need to do to pay less?
Well, you don't have quite as much clout as the federal government, so I'm not sure.
It doesn't seem fair.
Well, many providers actually lose money serving these patients, which is how they justify the cost shift.
How do they shift costs?
Basically, they add margins to the commercial insurers. It comes to an estimated $1,800 per family, or 10.7% more than the total cost of insurance without cost shifting.
Will healthcare reform fix the problem?
Health reform may amplify the challenge. In 2014, subsidized plans for low-income individuals will lead to a flood of new Medicaid patients. Also, and this is caused by demographics and not healthcare reform, as baby boomers become Medicare eligible, they leave the high-margin commercial business.
So the insurance pool will have more and more people paying less.
Yes. It introduces new revenue challenges for hospitals and doctors.
This sounds like another example of everything going to hell in a handbasket.
Well, the same National Business Group on Health study also found 16 cities with little or no cost shifting. That may point to a solution.
How do providers in those cities avoid passing costs to other payers?
They're more efficient managing the resources they have, especially where demand for hospital beds is likely to exceed capacity.
It sounds like you are saying healthcare providers need to rethink their costs as well as their expectations for future income.
Just like any business that finds ways to do less for more, healthcare is not immune to this trend. As the research shows, cost shifting is not destiny, but a convenient choice in a financial system where payment and service are already somewhat disengaged.
So hospitals that continue shifting costs rather than pursuing efficiency are likely to find they have run out of options to remain profitable.
That's the implication. You can read more about cost shifting at healthcaretownhall.com.
healthcaretownhall.com. Thanks.